Basi mti wa kwanza hapo ni wa waziri wetu. Anachota mchanga. Basi na mimi ni tumshangilie kwa makofi mkuu wa mawaziri.
Alizaliwa na ya white blood match.
Pediatric surgery there. But to
This is a center that is going to serve not just the people of Vihiga, but far and wide in the country, as it forms a major cornerstone of the specialist eye hospitals that we have in this country. Prime Cabinet Secretary, there is a rapid assessment that is ongoing on avoidable blindness. And currently, the statistics as at December 2022 indicate that 4 out of 1,000 people in Vihiga County are at risk of blindness, yet these are treatable conditions. PCS, this translates to about 2,500 blind persons in Vihiga. In that estimation, we can project up to 200,000 Kenyans that are at risk. And therefore, I'm so happy to stand here and support this facility in the endeavors they're putting in to ensure that we are able to manage eye diseases in this country. We need to understand well that although you may see about 15,000 children blind in the country, them living with that disability is a huge loss to this country on matters economy. We had small challenges and delays on disbursement of funds to the National Health Insurance, NHIF fund. However, I am happy to report PCS, as at this morning, I received a call from Treasury that funds have now been disbursed to NHIF. And now the facilities, which I'm sure this is one of them, once your claims are verified, you are going to receive your payment. I want to call upon all other healthcare providers that they resume services, those that had stopped, as we process claims and ensure that we make payment. But again, I want to assure you that I am not going to oversee graft. I am going to ensure that we optimally use the scarce resources that are allocated to us.
And grateful to God for those who had the vision to establish this hospital. This hospital is playing a very important role in the area of treatment of eye ailments. It is the only hospital in our region, and I would say it's one of the few special hospitals in the country that are giving specialized treatment. So I want to thank the board through the chair, my good friend Lulu. Thank you for the good job. I also want to thank the staff for the good job you are doing. Further, I want to thank our development partners who have stood with us, who have worked with us to bring this hospital to where it is. We want to say we are happy and we want to continue working together. But I want also to echo what the chair has said. Our development partners are helping us. We can also come out ourselves. I know we have people in Vihiga, people in Western, who can be able to support our health facilities and other social amenities. So let us not wait for the development partners only. Let us also help ourselves. So I would like to re-echo that. As a county, we have agreed to work very closely with the management of this hospital. We have entered into a memorandum of understanding where we are going to work together through our partner, the CBM, who have generously helped us establish an eye unit in our referral hospital at Mbale. And they have equipped that eye unit. We have agreed we will work together, and particularly on the outreach program. And the outreach program that so far we have carried out has shown that Vihiga has a lot of problems with eye illness or ailments. So we need to really intensify our outreach program. I want to assure you that we work together. And finally, as regards to the Sabatia Sub-County Hospital, I want to agree with the MCA for the area and the MP for the area that this sub-county hospital needs a major overhaul, a major renovation before we rename it as Hannah Mudavadi Hospital. As a county, we have already earmarked to do the renovation, but as it has been said, we do not have enough money for the development. So I also want to join my colleagues to appeal to the ministry to come and also give us some help. But I want to assure the minister that we as a county, we are already planning to do the renovation and the uplift of the hospital. So they are coming in will be also partnership.
Watu wa Sabatia Eye Hospital. It is now about 27 years since we started this program. The success of this institution is vested in others who are not with us here today. They were here, they have gone. There are those who are running it today, and there are those who are going to continue with the process. It is important that as we mark 27 years, 27 of this eye hospital, we give a round of applause to the management team and the board because they have made us proud. They have engaged with the stakeholders very effectively, CBM, Lions, the Rotarians, and our other players, the University of JUCAT, the ministry. They have engaged very positively. And in the process, this hospital has seen better things. It has some of the state-of-art equipment. And as I was walking, I was just asking, and how much would this one cost? And they say, this one, just a piece of equipment. This one is worth 5 million. This one is 7 million. And there are others that are worth more. Inside here. This hospital, as you know, you can actually have your eye operation through laser. Through laser. In the middle of this county, you can actually have your eye dealt with through laser. That's not a joke. It's a very, very serious achievement. And we must consolidate and build on it. Looking at my notes, countries like Rwanda, Burundi, Cote d'Ivoire, Botswana, South Sudan have benefited from this institution, and cumulatively over 30 specialists have been trained from those countries through this institution. So you are also diplomats. Because through that outreach, you are now reaching other nations in this very specialized area. So we need to really harness institutions of excellence, institutions that provide unique services in our various sectors, and here specifically in health. They are now they've dedicated the children's wing. Then you have the grown-ups. Then you have the facilities that go here. So let us always embrace good management. And one of the things that I also say is strong with this institution is that it has embraced working with people from all over the country. Mr. Chairman and your team, you have done us proud. You have not been inward looking na kusema kwamba hii ni ile alafu tunaweka ukabila ndani, and you don't want to work with everybody. Everybody works here. That is how national institutions should be. That is how we can grow our country, by bringing everybody and working together. Susan, thank you so much. The leadership of the hospital here, asante sana. And it's a very green area. I'm sure you can all see the greening of, when you have a hospital in the middle of greenery, people don't even know that the hospital is here until you move in. Then you realize that the environment is so good, even for recuperation, for healing. When you are able to see the greenery and walk around, unapona haraka. Ama namna gani? Unapona haraka. And please take medical care seriously. What Susan was saying about the health workers on the front line is very important, because some of us may not know that we have diabetes, as an example. And one of the earliest signs about a condition of diabetes sometimes is usually the eyesight beginning to wane and eventually maybe disappear. Sometimes it's not the eye per se, but maybe it's a condition around something different. So let us always check ourselves. Let us always try and save a stitch in time, because a stitch in time saves what? 9. A stitch in time saves 9. And as I conclude, I want to appreciate and recognize all the people who have journeyed over the 27 years to make this hospital what it is. The ones who donated the land, the church that partnered with CBM, everybody who has been party to this success, tunasema asante sana. Let us continue working together. We will seek more partnerships so that it can become even bigger and better equipped going forward. And I can tell you that with the collaboration of the Ministry of Health and the team and the University of Jomo Kenyatta University College of Science and Technology, if I can visualize what it will be if we really just continue pushing together, I think you are in for very, very big news in the years to come.